All right. Gut Health
It's the gut
Television.
show.
It's the gut show.
Okay.
Got to listen to
So,
your gut, right?
yeah. So I'm Kristen Craren. Everyone knows me, Therapy Practice University. I'm a therapist out of St. Louis, Missouri. I work with a ton of anxiety clients. I do a lot of couples work, lots of divorce, and I do work with children. And this is Dr. Flory, who we're going to be talking to today. I'm letting him take the wheel today because sorry there, I disappeared for a second. We will be discussing how your gut affects your mental health.
Yeah, that was a fancy trick there, Doc. I like that. That was a fancy disappearing act you had there. Yeah. The gut. Follow your gut, right? It's like we're taught in one way we're taught to pay attention to our gut instincts in these things, and the deeper we get into discussions like these, we really see why we're starting to call our gut our second brain, right? And some things like that. It's pretty interesting. Not a lot of people know on the offset that something like serotonin that we just kind of naturally associate with our brain, our head space, our emotions, how the lion's share of serotonin in our body, we're talking in the 70-80% of entire serotonin is produced in our gut. Now, that serotonin doesn't make it into the brain, right? But when we acknowledge, I guess would be the best way to say it, that everything in our body is in some sort of balance, homeostasis with each other, right? And existing in that kind of balance, that certainly there's still going to be a influence, right, of all that all that serotonin that's supposed to be produced in the gut, and that biochemistry that happens there, that there's still an importance in that fact that there's so much there's so much that's produced there in the gut. So anyway, that's just kind of a little fun fact. All that serotonin, the serotonin specifically in our gut is going to help with some motility, some other sorts of functions that we don't necessarily associate with kind of our brain and our emotional health, but still very active.
Got it. So I've had so many clients come in with anxiety, and sometimes it's connected with trauma, and we do a therapy called EMDR. If you're a therapist, you know what EMDR is. If you're not a therapist, it's just a modality of therapy to help with trauma that I found to be very effective in the treatment of anxiety. But sometimes there are these clients that come in who are anxious, but they don't really know why. They're like, yeah, some things have happened in my life, but I feel like I've really resolved it. And as a therapist, I'm always curious about this. Is it really resolved? Because it could be resistance or something else. But at the bottom of the barrel, it's like nothing is really, like, as far as mental health is concerned, causing this anxiety, which leads me as a therapist to think like, okay, there's something else at play here. And I have conversations with all of my clients weekly that there's all these different areas of influence on our mental health, one being your biochemistry. And your gut is, like you just said, a huge source of something that could be either hurting you or helping you with your mental health. So if you could help us understand how people, therapists themselves, or how they can help their clients figure out once and for all, like, okay, is there something going on in my gut, and what do I do about it?
Sure. Yeah, that's a good question. Maybe we'll just start addressing that by, let's kind of hit on something you hit on there, right? The condition or the demonstration of symptoms of anxiety, right, in somebody. Absolutely, the conditions within somebody's life and their environment can and will contribute to hormonal neurotransmitter shifts. Just a quick aside, you're going to hear me, if I talk about hormones and neurotransmitters, I talk about them largely in the same breath. They are the same. They have the same chemical backbone structure-wise, and so there are communication molecules, and so I talk about them in the same breath very frequently, right? It's just the neurotransmitters are kind of cholesterol, fatty acid backbone with some amino acids on there, blah, blah, blah. And they're used by our nervous system for communication, whereas in hormones, they're used through our bloodstream for communication in our body. And so I talk about them similarly. And this kind of gets into that question of anxiety. So, these outside influences, traumas, stressors, they can certainly be maybe one of the first dominoes falling.
I see. That makes sense.
Yeah, but then there are certain physiological, like you say, you sometimes identifies that there seems like something else is behind that. And, with anxiety in particular, we could have problems with blood sugar, right? And so we might have some insulin resistance. There'll be some overall generalized hormone and neurotransmitter resistance, which is actually kind of a disease, if you want to call it that, of the cell membranes. The cell membranes aren't healthy, and so they're not receiving the signal of the neurotransmitter or hormone in an effective way. There are other sorts of adrenal issues that could be going on. And so, one thing that I do if there is a predominant kind of symptom pattern set that's laid out with clients, and they talk about the experience of anxiety, is they really fill out a brief questionnaire that can kind of break it down to, okay, do we have amino acid deficiencies? Do we have hormone resistance, especially insulin? What's going on there? And that really gives is it a malabsorption issue as to why there's a protein deficiency, amino acid deficiency. And so it really kind of begins that process of sniffing out the etiology, what's really underlying that experience. Because, I'm sure their experience is accurate, right? They're having anxiety. It's just kind of, what combination of things are going in to make that happen. And really, with other classical kind of emotional disorders, or however we want to, classify those, I'm not sure really what the appropriate term would be there, but, let's take depression. Lots of depression is misdiagnosed thyroid disease, right?
Absolutely. When I do not take my thyroid medicine, I quite literally have bipolar symptoms.
Yeah.
And I'm dizzy. And I'm like, oh man, I should have refilled my prescription 3 days ago. And you and I are working on hopefully me getting off of that as soon as my supplements come in and everything, which I'm so excited about, because I've been suffering from anxiety, and I went in to see a psychiatrist, and it's like, okay, I'm going to really dedicate myself to trying to take some of these meds. And I'm just like, I do not want this in my body. Like, this is a Band-Aid, obviously.
Yeah.
Something else is going on. I know it.
Yeah. Well, and I came from that same place, 8-9 years ago. I found myself real sick, lots of brain fog. I was developing some autoimmune conditions. My thyroid was shot. I let it go so far, Kristen, as to where I started getting autoimmune vertigo. And so I'm driving down the interstate highway and the world starts spinning. And that's just kind of one of those symptoms you can't put off any longer, right? But, I ended up finding mine, and here's where we can kind of, move on into gut and whatnot then too, as soon as you're ready. But, I found at least part of one of the main cruxes for mine was candida. And that's not everybody's case, right? So I don't want anybody to think, oh, I, have candida all of a sudden. But for me, it was, right? And all the gut inflammation that went, that was downstream of that. And so there's really a lot of ways then that the gut plays into throwing off, imbalance for these neurotransmitters and hormones. So that, that's certainly something that we can kind of dig into and explore here a bit.
You have something to pull up for us, right?
Yeah, yeah,
That what you're after?
yeah, absolutely. So I'm going to pull up a
Okay.
couple images just to kind of lock these things in. But one thing to remember as we're talking about this is that even the New England Journal of Medicine and other peer-reviewed journals will cite various figures anywhere between 75 to 90% of all of the entire diagnostic catalog. This, includes all your systemic as well as psychiatric diagnoses. All of these diagnoses are, that percentage of them anyway, are related to chronic inflammation, right?
Yeah.
And so this really becomes something that should be of special interest to those with chronic inflammatory conditions. The emotional or psychiatric conditions are certainly in that category because they're so intimately associated with the balance of neurotransmitters and hormones, and that's both male and female, right?
Yep.
Um, you know, whether it's low T or it's hormonal imbalance for females,
Like
those are
PMDD comes up a lot with females,
yeah,
like heavy PMS,
yeah,
and it
PCOS probably.
yeah, and it can be a huge symptom of the things that we're talking about here, and such is so much easier of a fix than go see your psychiatrist once a month or load up on all of these meds or whatever it may be. It could be surgery even.
Yeah, and one thing that I like to talk about at this point is that what we're trying to do is really try to build more of a case a uh, for a background for a intelligent treatment plan, right? Because if you just go in to a psychiatrist and say, hey, I'm not feeling right, they're going to start to classify, categorize some of the symptoms, and then there's very little in the way of blood testing or anything like this to say prove a
Yeah.
condition, and it's just now about trying this drug and this combination, and so you know that's been the way it's gone for a number of years. On my end, I like to look for causes and like to have something a little more
Yeah.
evidence-based when it comes to, hey,
Yeah.
here's something we can treat, right? Here's something that we know is going to throw off the balance of neurotransmitters, rather than just kind of try something, see how it goes, and then
Right.
try something new. So but yeah, people with allergies, asthma, with the skin rashes and dry skin, people with autoimmune disorders, people with metabolism or thyroid issues, chronic pain, inflammation.
Metabolism is huge. So I was on the internet after you and I talked about my protocol. We've done this gut testing and everything, and came up with that I'm missing all these bacteria and everything. And I got really curious about the impact of bacteria that's in your gut, like on your body. And I was just personally interested in metabolism because like I'm super active, but like my weight isn't indicative of that. And so I came across this article about how these researchers had these two sets of mice. One was a heavier group and one was a skinnier group. And so they took the bacteria from the smaller mice and put it into the larger mice who were carrying more weight. And the mice from the larger group actually lost weight because they had the bacteria
Yeah.
from these other mice in their gut. And so that tells me two things: that your gut matters and that you can make a change
Yeah. Yeah. You're
without medicine,
right. Yeah.
without like taking psychiatric medicines or weight loss pills or stuff like that.
Right. Right.
Change your biome.
Yeah, you absolutely can. It's super important. As of right now, actual microbiome transplants are really only approved in this country by FDA for some of the more serious, say, ulcerative colitis, those sorts of conditions. But imbalance, whether too high or too low, and we're talking about not only pathogenic organisms, but even organisms that are normal, right? The
Mm-hmm.
ones you normally would find in your gut, too many or too few of them are both inflammatory problems, and
Mm-hmm.
can be, there's already lots of citation in the literature of this, what we call dysbiosis, or shift off of normal, right? Of this condition with IBS, inflammatory bowel disease, of course, but then all of your autoimmune conditions, right? Metabolic disorders, diabetes, high
Wow.
blood pressure, high blood pressure, and mood
Yeah.
disorders, you know,
I mean,
just
it's not just it's hard to just stay on the topic of anxiety, because it's not just anxiety, it's everything.
right. And part of the reason why it is everything is once you get gut inflammation, it starts messing up your uh, what we would call your nutrigenomics, or say your B vitamin processing is another good way to
Hmm.
say it, or this MTHFR thing that we've had a little bit of discussion about, because it does play in here. But basically, you know, I'm going to go ahead and put up one of those images now, if that's all right.
Okay. Yeah.
Kind of,
Go
yeah.
for it, guy.
We got to remember that if we're looking at a cross section of the gut, um, that the innermost layer of that gut is actually skin tissue. It's epithelium, okay,
That was so
histologically.
interesting to me when you said
Yeah,
that. It blew my mind.
yeah, and that's the reason why we see combinations of symptoms very frequently. I know somebody has a gut problem and they've got gut inflammation if they have allergies, if they have, you know, asthma, if they get chronic sinus infections, right? If they have eczema, dry skin, they get rashes,
Mm.
hives very easily, because that skin uh, in the gut responds to invaders, toxins, or even food that's been
Yeah.
determined. Yeah, a food that's been determined a problem for the immune system. It demonstrates this in what we call IgA inflammation, and that shows up not only of this pink layer of the epithelium in the gut, but also in the outer skin and the respiratory epithelium skin. So that's one clue, right? That you've got somebody that probably needs some gut work, or their gut looked at.
Yeah.
Is it, yeah, besides, you know, the clinical things we're looking at and treating for, you know, do they have some of these, you know, concurrent situations and conditions going on, some of these aggravations? um, so that's one major thing. And then if you think about really, if you think about what that tissue is doing, that pink layer, what it's doing, it is absorbing the things that it needs to absorb. So our vitamins, our minerals, okay, our nutrients, so our amino acids, our healthy fats, that sort of a thing. And it's keeping out the things that we don't want to absorb. All right, being bacteria, you know, that might like to infect systemically our bodies and gain hold there, or other sorts of toxins in the environment, things like that. And you know, I put this image up frequently because it's really interesting to take a look and see along the gut lining, where do we absorb certain things. And it's
Oh,
really,
yeah.
yeah, so you got to think that inflamed tissue, that epithelial skin that's inflamed, is not going to do its job the same, right? Keep it really simple. It's just not going to do the job the same. And that's going to go, we'll see here, for two situations, major situations. That's absorbing what we want to bring in, but also that keeping out what we need to keep out. Okay.
Yeah. As you talk about this stuff, even
Yeah.
though we're not directly talking about how this can affect our counseling clients, it just illustrates how complicated our bodies are. So when we have as therapist clients coming to us, we need to really be fully aware of this full picture of the body, because these anxiety and depression clients, and there's all sorts of other clients too that come in, that we need to teach them that it's not as simple as I'm having this feeling, let's fix it.
Yeah.
It There are all these other systems involved in your body that, hey, go find a functional health doctor, because your regular doctor is probably not going to do these tests, but
Right.
or have these conversations. But find yourself a functional health doctor and just do a check-in. Like,
Right.
and what I like about you, Dr. Flory, is because, you know, I was on the functional health train, bandwagon, whatever you want to call it, like you know, before it started becoming more mainstream, but these
Yeah.
doctors were really inaccessible because they were extremely expensive, like exorbitantly expensive.
Right.
And now there's more doctors like you joining the scene, and you are so accessible. Like, it's not going to cost you $1 million to get to the bottom of what the issue is. It's
Sure.
where you've made it really easy. And so I've sent a ton of referrals to you because I'm like, just check it out.
Right.
You know?
Well, it was part of my frustration in kind of typical traditional delivery style of private practice. It was a frustration of mine to see, well, who was going to make it, right? Who was going to be successful on their protocol because they could, spend this money, they could spend the time, they could travel halfway across the city, maybe, into Missouri from Illinois, across the river, these sorts of things. Who was going to be successful? And it was disappointing. And I mean, I don't like to be frustrated, and I'm frustrated when a client's having frustrations, right? And
Well, the
having
easier you make it, the more likely it is for your clients, yours and
right.
mine, to
Yeah.
go check it out. Like, I did all of my testing from home.
Right. And that's really, just something to just touch upon then. Yeah, I had a vision for a different way of delivering this information to people, and it's through functional health team. And all of our visits for clients are, they all can be accessed through their living room, right? Through their phone, their tablet, their computer, through a secure HIPAA compliant telemedicine platform. We've got a health support portal called our Daily Care System that delivers all, securely the client's protocol information. It gives them a communication portal with which to communicate with me. But it's also called Functional Health Team, and not just Functional Health Dr. Flory. And the team basically means that clients that are working with Functional Health Team have not only the care coordination from myself or someone like me who has a functional medicine doctor role, and kind of outline the progressive course of that they'll be on, but then they have dietitians, maybe a music therapist, a breath work therapist, decluttering home organization, detoxification coaches, all these people that can help them out either in a class group type setting that, again, they access conveniently from home, or even on a one-on-one kind of consulting kind of
It
a
makes it
basis.
easy.
Yeah,
That's where
exactly.
the market's going.
Well, yeah, and for those people that are practitioners out there, it's important to understand that we team up with practitioners. We don't take over, right, the cases from you. What we really do is we provide these things that are going to be useful for your clients, that we can team up on, do the functional medicine end of things, but let you handle what you're great at, right? And let the client take a nutrition class with a nutritionist, because maybe you don't do nutrition in your practice, those sorts of things. So
Right.
we really just
It
kind of,
takes a team.
yeah.
It absolutely takes a team, because I can't do it all.
Well,
I
and
can't
you don't want to do it
know
all either, do
all
you?
of this.
Yeah.
No, there's no way. There's no way. There's so many, the body is so complicated, and there's
Yeah.
so many variables that there's no way that one mental health clinician could know what you know, what the nutritionist knows, whoever else,
Yeah.
and you
Yeah.
can't know what I know, right?
No,
So,
exactly. And it's also my belief we shouldn't try to, right? Do what you're
right.
passionate at, because you're really going to serve people the best. And when you're doing that, we can create cooperative environments to where
Yeah.
that client can really be supported then. And it's my belief that that when we set that up right, that it's better for everyone. And so what will happen is, when we do work together with other practitioners on that practitioner actually gets a login credential to the portal, so they can see what's going on with those clients. They may not be involved, right, in the detoxification classes or the nutrition or the functional medicine program, but they can see what's going on. So they can still talk to their clients from an educated position, and still support them It's just now that practitioner looks like the genius for saying, hey, you've got some deeper things going on that need explored, right? And I think that's the important part of cooperation. So,
Yeah.
but
Okay.
the importance, just to wrap up this image right here, is that there are areas of your gut where it's very limited, certain vitamins and minerals where they're absorbed. You look at B12, for example, B12 is only absorbed in the latest parts of the small intestine as it attaches to the large intestine.
And what is B12 effect?
Well, B12 is going to be it's going to be part of this methylation cycle, so there's impacts on MTHFR. Let's put it this way: a lot of people are going to have heard of SAMe, a methyl donor, right? That's very important, and it's even a treatment for in a lot of depression cases where people aren't responding to medication very well. And SAMe requires methylated B12 to interact in a couple of reactions to produce that SAMe. So it's just super important when we are talking about DNA replication, RNA, neurotransmitters, hormones, these sorts of things, detoxification in our body. And so if we look at our gut, the way it's laid out structurally, now we can show here with this diagram where the B12 is absorbed, but even more importantly is then anatomically in this same part of the ileum is where we and then in the same part of the last few inches of the ileum, and then in the large intestine, that's where the vast majority of the organisms, right, our normal bacteria, our microbiome, that's where they're supposed to live. And we have huge numbers of these organisms. We're talking into the millions and billions of organisms that live here. However, if you start going up in the digestive system, those numbers of organisms, not only does the type of organisms, but the overall number start dipping down into the thousands or hundreds of organisms in the upper GI and stomach. And so the point here simply is that you're not supposed to have a lot of organisms up in the upper GI, and you are supposed to have a lot of organisms in the lower GI. Okay, when you do start getting upper GI organisms, then the actual mobility, the motility of your gut, the muscle action starts to slow down in that tissue, because that's not normal for it, because there's not normally supposed to be many organisms up here. It starts to inflame chronically, okay? And so that tissue now, besides move things through the gut, including toxins for excretion, because your liver is processing all these toxins and it's going to dump it out into the upper GI, and you got to, these toxins produced by your liver have to travel through the entire gut to be eliminated. But not only are you going to have issues with motility, but also then with inflamed tissue isn't going to absorb vitamins very well, right? And so if we start to get what's called as bacterial overgrowth, right, SIBO, and even if it's subclinical in that they haven't maybe tested for a breath test, which is the gold standard for SIBO, to where that they're positive on that yet, they could start to have a lot of organisms building up in this lower part of the small intestine, and that's where B12 is absorbed. And I find so many people that are getting B12 injections, and
it doesn't make a difference. I actually did B12, like the IV drips and stuff with all these vitamins in it, and it did not matter.
Yeah. Well, and so many of these people actually, deep down, they've got a problem with overgrowth, or maybe it's a pathogen, something causing absorption issues in this part of the small intestine as it feeds into the large intestine, and so they're not absorbing their B12, right?
So this is like a long, it feels like, when I first listened to the story of the gut with you, I was like, this is such a long story about this gut. Yeah. But it is like, to really understand it, like, it starts in your gut, and then there's all of these processes that that your body has to go through. I don't know how many steps there are, but there's a ton of steps. And then it gets to like this methylation process that you're talking about, and affects all these hormones and neurotransmitters. And then at the end of the story, you have the anxiety and the depression. I'm not trying to give you trouble. It's like, because as people are listening to this, and this may be their first time listening to this very complicated story of the body and the gut and inflammation, I mean, I suggest listening to this whole talk like 3 or 4 times so that it'll sink in.
You have to. I mean, I know when I first started down this road, it was a bit overwhelming, and I can get a little long-winded on this stuff, you know, I know, so rope me in if we need to, but
No, you're fine. It's just necessary to understand it.
Yeah, the details are important here, right?
Exactly. That's my point. Yeah.
Yeah, exactly. That's a great point, because it could be, you know, B12, right? Like cobalamin, that's a problem. And just, you know, as a caution, the B12 injections, another reason why they're not always successful, Kristen, is because cobalamin, B12, generally you're going to find it in a supplement, or even most of the injections that I know of days past anyway, they're cobalamin, not methylcobalamin, right? The methylation,
it's not bioavailable.
It's not bioavailable, right? And so if you have the right combination of issues going on, right, with this whole inflammation thing, you can get a shot and not be able to convert it into the physiologic form too. So there's a lot of downfalls there, and some of the strategies that I like to use, if all of that is in play and somebody's going to struggle with the unmethylated or unphysiologically active, ready to go versions, is to actually bypass the gut. You can use lozenges of certain types of B vitamins that are pre-methylated that we have access to as doctors.
Oh, cool.
Even if you have absorption or suspect absorption issues, well, you skip the gut, you absorb it up under the tongue, you know, and so there are really there are accessible solutions for this stuff, but you have to ask the right questions, right? You can't just you can't just read somebody's blog or watch anybody's video, even though we're doing a video right now, because if you aren't asking questions, then that person who's providing you that information, it may be absolutely accurate, and this goes for myself included, but they don't know your specifics of your condition. And until you know those specifics, you can't ensure that you're taking the right steps. And that's one of my greatest messages.
Absolutely. And I'm gonna put you on the spot here. Can you give like maybe, I don't know, I'll say 5 because that's a round number or easy number. 5 questions that therapists should ask their clients in that first session where it's like getting to know you, you know, like what should we ask them that will give us clues that we need to send them to you?
Yeah. So autoimmune conditions or a thyroid condition, right? 90% of thyroid conditions are autoimmune. Okay. So those are huge. Screening for those things basically means they're going to have this gut problem. They're going to have the immune function problems.
So number 1, do you have an autoimmune disease like thyroid disease?
Thyroid disease, suspected of thyroid disease by your doctor, or any other autoimmune condition. Second, sluggish metabolism, because that's going to mean they have a thyroid condition that they don't know about, right? Thyroid's probably the most undiagnosed condition out there. Also ask questions about blood sugar crashes, right? Those sorts of, so that would be, headache, afternoon fatigue, a short fuse. A lot of it goes into this, and the anxiety people will be, this category, right? So any questions around blood sugar regulation is going to be definitely somebody, and then, you want to know, you just want to screen for brain fog, right? Those sorts of things. if you ask those questions, if you pull those people out in the initial conversation, that's going to be 95%, that's going to catch 95 or maybe even more percent of people that you really should be suspecting these sorts of things.
And this, I'm trying to catch things that because I'm a therapist and I know how they think. And one was, this is a really long story about medical stuff. Well, listen to it more than once and let it sink in. And the second thing is I don't know, this medical stuff is outside my wheelhouse. Okay, yes, you're not a doctor, but you can ask these questions from a holistic perspective so that hey, do we need to get another professional in here?
Yeah.
Because these people are coming to me as a therapist to solve the problem of anxiety. Right. And so it is my responsibility to look at the big picture and to refer them where I need to refer them.
Well, and in my experience, it's only going to solidify you as a therapist, right? As to be somebody who can provide long-term appropriate support for them, because now look at everything Well, in this case, for them to really maximize that, they're going to need a little bit of something else. And so again, we were taught in school that it makes you look like a genius, so people want to stick with you, right? So so that's what I'd look for. The chronic fatigue, the chronic inflammation, chronic pain, certainly digestive symptoms, right? That's got to be in there too. But the respiratory conditions, the skin conditions, because of the epithelium kind of question, and you're going to be very, very well identifying those that need some additional support.
And what's your diet? I have a background in I was a personal trainer and I was a power lifter there for a while, and I'm not a dietitian, but I know enough to do some damage to talk about diet. And I think that once you get these questions answered about, a little bit of medical history and what's their diet like, and even if they're working, with you or another doctor, whoever, there's a lot of emotion rooted in making these changes that have to be made to rid themselves of the anxiety.
Right.
So I have plenty of clients that they have the inflammation, they have this, they have that, they've been to the doctor, but they are emotionally dependent on their old lifestyle. So therapists can really help bridge the gap between the old lifestyle and going into the new age, the new lifestyle.
And what an important, that's the most difficult part. I can come up with a care plan, right? But that's one of the frustrations I saw in the typical, delivery of these functional medicine protocols was to people, is the need for that support in making life changes.
And this will keep clients too.
It will. It will. Exactly. They stay around when they're getting better, right? And when they have the right support, it's obvious to them. So a lot of these absorption issues, as we looked at the gut, those will have those effects. And we're not just talking about B12, but serotonin also requires vitamin B5 and B6, and so those might not be being absorbed right, or is it maybe it's the amino acids that aren't being absorbed right, or the fatty acids. Our neurotransmitters and hormones are literally combinations of small little building blocks of our fats and our and our proteins and whatnot. So all of these things are things that we can help kind of drill deeper down into and provide support appropriately. Whether it is just say, the fact of the matter is that a lot of this, you ever hear the term leaky gut, Kristen?
Oh yeah, you taught me about leaky gut, and the picture, the diagram that you put up was amazing, because I was like, oh my gosh, that makes so much sense.
Yeah, we'll put that up again here.
Leaky gut for me was like really an abstract idea. I'm like, leaky gut, okay, what does that mean, and how does that affect my anxiety?
Yeah, and so we can kind of really bring less mystery to that term now, right?
Yeah.
because we know there's certain dietary proteins that have the right configuration, that they look like other pathogens in the body. It isn't this gluten thing, right? Isn't just some mystery as to why it's like that. There's molecular mimicry Okay, and so we can break it down kind of like that, to where our immune system recognizes certain proteins in certain foods. It actually looks like pathogens, right? And so that's why so much of this crossover can happen. But if maybe it is foods, maybe it's the fact that we were taking, we had a number of rounds of antibiotics, because we had strep or ear infections or things, I don't know, whatever it was as a kid, right? And these antibiotics selectively killed off certain organisms in our microbiome, and it allowed for others that are not very helpful to grow up and take a large, kind of root in our gut. And so we're left with kind of the aftermath of inflammation. People should know that the number one cause of leaky gut is stress. It is the hormonal and neurotransmitter. It's the implications of stress that in and of itself will cause leaky gut. And so, again, we all need to be working with each other here, because we're seeing people where this crossover in terms of supports necessary. There's gut infections. Like, again, one of mine was candida. But there's parasites I find in people frequently. There's bacterial infections that literally just eat through or perforate your gut lining.
And then they affect this process, which
that's right.
We go down the long story again, and it affects their mental health functioning. And
absolutely,
in my office, and I'm trying to go through, their childhood and this and that, and it's like, okay, so you need to really check this other thing out, and just to make sure we can keep doing our work in therapy, because you're definitely going to get something out of it. But certainly, let's eliminate all these variables.
Yeah, just to accentuate that progress, accentuate the opportunity for improvement.
Right. Yeah.
Because even normal life, what I want to say, normal life occurrences of a pregnancy, menopause, daily stressors. These are all things that, if they accumulate too much together, or in quantity on their own, they're going to cause leaky gut, and they're going to allow for then undigested food particles. They're going to allow for undigested food particles to take up root in the gut. Right.
That leads to infection. That doesn't sound good, because I know when there's food particles stuck in the crevices in my refrigerator, mold grows.
Yeah, that's right. That's absolutely right. So, that's really what this story is on the leaky gut, because once that tissue, that inner layer of pink tissue, once it now is allowing things to get through, this is where it turns into autoimmune disease, right? And we start to get the deep issues with the balance on our immune system. Now, here's where we get the chronic inflammation, the autoimmunity, chronic nutrient deficiencies, and we start affecting things like the brain, because the brain also has one of these epithelial, or it has one of these barriers that gets broken down, just like the leaky gut barrier. Okay, so
it all makes
such an
sense.
issue.
Can you pull up, before we end here in a minute, can you pull up that really complicated representation of methylation? Just that, like, really illustrates what a complicated process our body is involved in, and how it affects the end game.
Yeah,
of
certainly.
mental health.
Certainly. Let me just find that real quick.
I saw that and I was like, oh my word.
Isn't it interesting? I mean, I'll tell you, I get pretty geeky on some of the gut stuff and all this, but this is really where this is really where let my geek fly on these right here, because this gives you, the knowledge of this gives you so much. What I want to say, it gives you so many options for treating and supporting someone that you really had no idea frequently were available. So let's see. Here's a great one. So what I'm going to pull up right now is it's a biochemical pathway diagram, right? And at the top,
it sounds so complicated. We're all so smart for listening to this.
We're,
feel like super intelligent right
I,
now.
I
Look
can
at that
feel
graph.
myself getting smarter, right? It's like, yeah, we pat ourselves on the back.
Yeah.
So up in here, right, in this 5,10 methylene tetrahydrofolate, blah blah blah, big word. This is folates, right? This is our
Mhm.
green veggies. Right? This is, again, this isn't folic acid. Folic acid would be way outside this chart. It has to be
Different. Yeah.
processed like 8 or 10 times to even get down to this point. But this is the MTHFR enzyme that we hear so much about. And certainly I see a lot of people and strategize with people a lot for that. But
Yeah. And if you don't know what MTHFR is, look it up, because there's many of your clients that may be undiagnosed that does affect your mental health majorly, because it affects your absorption, like
it,
Dr. Foyer was talking about.
yeah, it does. And we'll just hit on some highlights here as to why that is. So you really get a good idea of why it is you're concerned with this. One thing I would mention is that a lot of people will know about the option for a blood test for MTHFR, and it's not that
Mm-hmm.
there's anything really wrong with that, but you're paying, however much you're paying for only an assessment of that enzyme. And if you do something like a saliva test with like a 23andMe or some other full genome assessment, that can be very helpful for somebody like myself when we start to look at them, because as you can see, there's not just one purple box on here, right? There's all kinds of them, and all of
Yeah.
these enzymes are things that we can assess and understand how they're working together intimately. But we were talking earlier about right here's where B12 would come in, right? And so the folates continue along with these arrows through the B12, helps get processed. And up here's our friend Sam E we were talking about, and how it's related to uh, uh, processing our neurotransmitters, our helping our DNA with replication, and just all kinds of other various things in the body. But what you'll notice down here is that serotonin and dopamine show up on this chart. And so the reverse of the MTHFR 677 enzyme, which we're getting a little technical there, which is the MTHFR 1298, feeds, instead of the B12 and the SAMe methionine pathways, it feeds the opposite, this biopterin, BH4 pathway. And it will convert some amino acids, tryptophan and tyrosine, into serotonin and dopamine. So,
Mm-hmm.
when we look at this, it really only takes one quote unquote swipe of this circle, a very efficient pathway to produce serotonin and tyrosine when it's operating right. But
Right, that's what I was just thinking. When it's all going well, and to know if it's going well or not, definitively if this anxiety or depression is like experiential, or just, maybe you do need medicine for some reason.
right,
Like, make sure you figure it out, because it very well could be something else, like
right.
that you don't, it could be fixed in, I
And
don't
it,
know how long,
and
6 months, a year, you could have it resolved. Is that right?
Yeah, six months a year. I mean, it all depends on everything that's going on.
Right.
Some people have
Yeah.
more going on than others, but one of the things I frequently see is it's multiple things, right? When I was getting healthy, I had to take care of my diet, and I took advantage of this sort of an understanding that we're looking at right here, and I dealt with my personal nutrigenomics, the combination of my genome, unique genome, with nutrients. And I had to do some detoxification. You'll see here that aluminum or lead can block enzymes in this pathway, and so we have to be aware of that, and help with the diet. But by the time I was really sick, I had bipolar symptoms, and
Mm-hmm.
and it was, and I had to both deal with emotions as well as my nutrition, right, and my
Mm-hmm.
biochemistry. And by
Yep.
doing those things in in um, in concert with each other, that provided a really stable improvement platform, right? It's just everything helped
Mm-hmm.
me float more to the top. And so, yeah, we'll see how these are really important in providing the serotonin and dopamine,
Right.
and really serotonin, once it's through here, it needs B5 and B6 to finish this to finish off the serotonin pathway there, which it can lead you back to
Yeah.
some of your absorption issues if you have them. So we just have to be aware of this stuff. And one of the advantages of knowing this information and going to this degree is that if we need to skip an enzymatic step, we can, and that could be a band-aid for somebody while we fix other things, right? For instance, if somebody has MTHFR and it's just made worse by a gut problem and gut inflammation, in the meantime, I can give them 5-methyl tetrahydrofolate to skip this whole step. I can give it to them in a way that bypasses the gut. It triggers the production of these pathways while we fix the gut that had absorption in the first.
Yeah, and as these things get resolved in the chemical level, when they go to talk therapy, like they become less resistant to therapy because their biochemistry is getting straightened out.
Yeah, they've got a better platform of success, and that's my message when I talk to others about this.
Yeah.
It's like you can really just improve the foundation for which clients have to be successful. So.
Well, hey, Dr. Flory, would you like to join our consult group and just kind of be in the group? If anybody has any questions for you, they can ask you or whatever. It's the
thing.
Therapy Practice University consult group. I'll message you the link so it's easier to find.
Yeah.
That way, if people are watching this, then they can just ask you. And if they have a referral or something, if they're from St. Louis or they have any questions, they can send them.
Absolutely.
Send them over. Sorry, I disappeared again. I'm on my phone and I'm getting like 10 phone calls since we've been doing
Of course. Perfect timing, right? Yeah, no, I'd be more than happy to do that and answer any questions that came up.
Sweet. Well, thank you. Thanks, Dr. Flory, for explaining everything about the body and concern with anxiety and depression. I feel like every time I talk to you, I understand it more and more, and it becomes more like a second nature kind of conversation rather than like, it can feel daunting at first, like, whoa, that's complicated, but it's just how the body works.
That's right. Yeah. Thanks so much for having me. It's important to be able to have this discussion on, hey, don't get me wrong. I believe food is medicine, right? But there are certain conditions of the gut that no matter how good you're eating and how controlled that diet is, you may not be absorbing your fatty acids, your amino acids, your B vitamins. You may not be able
That's
to.
me. You're describing me.
Right. You may not be able to manufacture go from raw materials to manufacturing the basics you need for succeeding for overall health.
Well, thank you. Thank you so much. And I look forward to receiving your video so I can share it with everybody.
Yeah, absolutely. Take care.
Okay.
Thank you.
Bye.
Bye.